Mr. President, this is at least the third time the Senate is debating Senator Marshall's proposal to terminate the national emergency declaration related to COVID-19. I'm going to have just a few brief remarks on why the Senate ought to vote this down and move on to the crucial year-end priorities that actually have a chance of becoming law. First, the Marshall resolution has been referred to the Senate Finance Committee. As the chairman of the committee, we have long focused on health care and particularly Medicare. And my view is that the Marshall resolution is part of a larger effort to create more red tape and less flexibility in American health care. Now, I've been talking to a lot of Oregonians about many issues over the last few months, and I can just say nobody's come up to me in one of our iconic Fred Meyer stores or at a town hall meeting and said, "Hey, Ron, we need more health care red tape." And I want to be specific about what this means. The Marshall resolution will make it harder to keep waivers on the books that have helped resolve critical shortages of healthcare providers and hospitals overwhelmed with sick patients. The policies allowed under the national emergency have also helped address shortages of medical supplies needed to treat patients and protect medical workers. Looking at the bigger picture, Mr. President, the Marshall resolution is part of a broader effort by Republicans to wipe out a host of important policies that have saved lives and helped our healthcare system stay afloat over the last few years. This larger effort by Republicans, for example, could make it harder for people to get hospital-quality services provided at home where they're most comfortable. There's a risk it would lead to a whole lot of vulnerable Americans losing coverage through Medicaid. Taken together, that's a recipe for chaos in American healthcare and serious headaches for millions of patients who'd have their coverage and their care upended. Nobody is saying that emergency policies that began in the pandemic are going to stick around forever. Changes do have to be handled responsibly, and what we try to do in the Finance Committee is work in a bipartisan way. So, colleagues, in my view, this Republican effort, and it's what we've been debating now again and again, comes down to less flexibility and more chaos in American health care. And that sounds like an idea the United States Senate ought to avoid. That begins with voting down the Marshall resolution. My sense is this is also exactly the wrong time to start undermining important health care flexibilities. Doctors and public health experts, we've all read these articles, are telling us this is going to be a painful flu season. We're hearing this across the country. Hospitalizations, colleagues, for the flu are already surging. At the same time, there's a huge wave of dangerous RSV infections across the country. That's particularly serious for infants and toddlers. It can be a big problem for adults, too. Many pediatric hospitals are overwhelmed. The flu and RSV are hitting just as the country braces for possibly another COVID wave during the winter. Congress ought to be looking here to support medical workers, protect our healthcare system from becoming totally overwhelmed by viruses, and save lives. The Marshall resolution and this broader Republican effort that we've been hearing about on the floor to eliminate healthcare flexibilities does the opposite. An earlier version of this Marshall resolution passed back in the spring because some members were absent for the vote. Colleagues, this is going nowhere in the other body. Now, I'll close by saying there are serious health care issues that deserve bipartisan attention here in the Senate. For example, Democrats and Republicans on the Finance Committee, many of them have been working with Democrats in a very thoughtful way for months on improving mental health care in America. We're very proud on the Finance Committee that 4 major provisions of our bipartisan work that we put in a year and a half on came out to be the black letter text on mental health in the gun safety legislation. So we want to work in a constructive way. You see that with mental health. Members on the Finance Committee have come forward with good ideas. That's the kind of work we ought to be doing on health care. My view is the Marshall Resolution is a partisan step in the wrong direction. I think it is a mistake for American health care at this crucial moment to reduce flexibility for government to deal with the challenges. And I oppose the Marshall proposal, and I yield the floor.